I just wanted to talk briefly about swelling. I've got persistent swelling. Here it is, day 10 post-surgery, and I've still got some swelling in the hand, the armpit area, what we call the axillary area, a little bit around the shoulder. And there's several reasons why I think I still have some swelling in the extremity after the surgery, one of which is the constant immobilization in a sling, which does not allow for the normal movement and muscle pumping action that helps the fluid move through the lymphatic system up towards the armpit where the lymph nodes are. Also, not being able to elevate the arm, that prevents some of that fluid from being able to move out. And of course, being in a sling in this flexed position kind of puts a kink in the hose, so to speak, so that the normal circulation is impaired a little bit. And then also, whenever you have a surgical procedure, just the trauma of the surgery obviously creates an inflammatory response, and it also disrupts the lymphatic system, which, without going into a lot of detail on the anatomy of the lymphatic system, it's basically superficial and deep vessels that drain fluid out of your body, both the superficial aspects of your extremities as well as the deep aspects of your organ system. So I'm going to talk a little bit about how I manage swelling as a swelling disorders specialist. I see swelling for a variety of reasons. Oftentimes it's surgical procedures, especially surgeries that involve removal of lymph nodes, as we see in our cancer patients. But it could be any surgery, knee replacement, any type of orthopedic procedure. You're going to get a disruption of those lymphatics, and it's going to cause swelling to congeal and stagnate in an extremity, and you want to get that fluid moving. You don't want to let it just sit there because it can be very irritating to the surrounding tissue. Just having swelling in my fingers for 10 days has made it very tight and painful for me to make a fist, and I can tell the aching is just a result of that fluid not moving. So I'm going to show you how we use a self-massage technique to move that fluid back towards the main drainage points of the lymphatic system so that you can reduce the swelling. And then we'll talk a little bit about other ways that we can manage swelling in a post-surgical situation like mine. Okay, so the way that fluid returns to the heart from our extremities and our organs is through the veins and the lymphatic system. The veins return blood to the heart. The lymphatic system picks up fluids and foreign materials such as bacteria and proteins and other things that somehow get outside of the arterial and venous systems and outside the organs. The lymphatic system removes all of those particles and fluids and takes them through your lymph nodes, which most of your lymph nodes are in your neck area, your armpit area, and your groin area. They filter out that fluid and then return it back to the circulation. And when you've got swelling, like I've got in my hand, then you have to sort of help that process along. The way that it normally works is through muscle pumping action, where the muscles pump against the veins and the lymphatic vessels and move those fluids back towards the heart, and then one-way valves keep it from returning back to the extremity. But after you've had a surgical procedure that disrupts that lymphatic system, you will have pooling of fluids, and you have to sort of help that system along. And the way we help that system is really three things. We use a self-massage technique, which helps move the fluid up that chain so that it can move past those valves and get back towards the heart. We also use compression, and compression can be in the form of compression bandaging, and that's what we use for extreme cases of lymphedema, where the extremity has swollen up to a point where it has to be compressed in order for the fluid to be pushed out. You can also get compression in the form of compression garments, which includes gloves and sleeves and stockings and things like that. And then the other way that we get fluid moving is obviously through muscle pumping action. And when you've had a surgery like mine and you're stuck in a sling and you're not allowed to actually contract your own muscles, then that leaves you open to developing some swelling. So what I'm going to show you now is a technique that I use for a variety of different types of swelling disorders, and it's effective for post-surgical swelling as well, which is just some self-massage to kind of get the fluid moving so you don't allow it to stagnate. And what we're going to do is we're going to start in the areas where the main drainage points of the lymphatic system are, and then The idea is that you have to clear those areas to make room for the fluid to move into those areas. So the analogy would be if you have a parking lot and you want to park some cars in there, you've got to move the cars out of the parking lot to get more cars in. So that's what we're going to do. And what we start with is just some diaphragmatic breathing, which is breathing in and having your stomach expand, and then breathing out and having your stomach collapse. And what that does is stimulates the deep lymphatic system in the abdominal area, and then we're going to work our way up to the neck. We're going to stimulate that area into the armpit. And what we're doing is we're just making very small circular motions where we're just moving skin. We're not actually massaging the muscle or putting a lot of pressure, and we're not sliding the hand over the skin. We're actually just grabbing some skin and moving it in kind of a circular motion, directing it towards where we want the fluid to go. So first, just take a deep breath in, and then exhale. Stomach collapses, breathe in. Stomach expands, exhale. Stomach collapses. I'll usually do that about 5 times. And then I want to come up into the neck area just above my collarbone here, and I'm just going to make some circles on this side, sort of directing the fluid towards the neck that way. And all I'm doing again is just making some circles and moving the skin in a circular motion. And then I can do the other side with this thumb, having to do everything with one-handed because I'm not allowed to move my right arm right now. Okay, and we're just going to make maybe 5 circles in each direction. Okay. And then once I've done that a few times, then I'm going to go down into this armpit, and I'm going to do the same thing. I'm going to make some circular motions kind of up and in towards the sternum. And I'm just trying to stimulate the lymph nodes in this armpit to try to get a little fluid moving out of there so we make some room for the fluid that we want to move out of the arm. I'm going to do the same thing in this armpit, just using my thumb, making some circles, trying to direct those circles inward towards the sternum like this. Okay. Then after we've done that, now what I want to do is just very lightly kind of brush across my chest, because what I'm trying to do is get fluid out of this extremity, and I'm going to move it over towards these lymph nodes over here and also towards these lymph nodes here, because I want to try to get that fluid to just move towards the lymphatic drainage points and then drain out of the extremity. And all you have to do is just a real light stroke like this, or in addition to that, you can make nice gentle circles, again, directing that fluid over in the direction that you want it to go. So again, I just do about 5 times across, just making those nice little circles, and all I'm doing is just trying to clear the area so that I can move the fluid from the fingers upwards, but we have to start where we want to end. And that's what we're going to do now, is just basically start working our way down the arm now, because we're clearing our way down before we start moving everything back up. And so I'm just making little gentle circles upwards, kind of almost like a half circle upwards towards this armpit up here. And I'm going to get the upper surface of the arm this way, working my way down. And then I'm going to try to get under the arm a little bit this way, and I can just use the back of my hand, or I can try to get under here like this and make those same type of circles, getting the underneath surface of the arm as well. And then I can kind of get back behind the arm and do the same thing, just working my way down. And while it may not seem like much, these little gentle circles that are moving the skin are actually pulling on what's known as anchoring filaments, and those anchoring filaments are attached to the superficial lymphatic vessels, and those anchoring filaments, when you stretch them, they open up those vessels and allow fluid and protein molecules to move in and be drained out. So it doesn't seem like you're doing a lot, but you'd be amazed at how much difference you can make in swelling with this gentle technique. Okay, so now what I'm going to do then is I'm going to start working my way back up the extremity now. Again, making those same kind of circles, and about 5 times on each surface of the arm. And I'm trying to work it on up. And then, get under the underneath surface. And I can also work the fingers a little bit, and you can actually just make some little circular motions on each of the fingers and try to move some of the fluid out of the fingers, and then work it right on up the arm. And make sure you cover all the surfaces, and then again work it past over towards the other armpit. And now another drainage pathway can also be down towards this groin, so it's a good idea to just kind of get your hand right in the groin area, the inguinal line, which is basically the junction of your leg to your pelvis, kind of right in that area, and just make about 5 or 10 circles, again circling in towards the abdominal area. And all I'm doing is just moving the skin, making a circle there. Okay, get a little drainage there, and then I can actually kind of work the fluid down towards that groin as well. And then you can even just do some real light brushing strokes and just kind of moving everything down towards that groin, moving everything across towards the other armpit, and that will usually be enough to get some stimulation of those lymphatics to get everything moving. And then what I would then try to follow that up with is some muscle pumping, and because I'm not allowed to move the shoulder, I have to do everything at the wrist and the elbow, so I can just do some gentle muscle pumping with the fist, the wrist. If I keep this stabilized, I can then turn the forearm over as long as I'm not moving the shoulder. I can also straighten out the elbow, and supporting it, I can bend the elbow as long as I don't move the shoulder, and I can get a little muscle pumping that way. So I'll do maybe 5 or 10 repetitions just to use that muscle pumping action to help drain the extremity a little bit as well. And then from there, that should be sufficient to kind of get that fluid moving. Now obviously, if you have extreme swelling or persistent swelling that just doesn't go away, that's something you might want to bring up to your surgeon. But typically, this will suffice to get rid of the minor postoperative swelling that occurs from having surgery and being immobilized. Another technique that we will also use a lot of times to help with swelling is what's known as kinesio taping. And kinesio taping involves using a specialized type of tape that is spring-loaded that actually stimulates the lymphatic system on the skin by creating skin traction. And I'm going to have my business partner Chris tape my shoulder in a way that will also facilitate some drainage of that fluid. And then in addition to that, we can use kinesio tape for positional correction, so that I'm having some problems where I feel like I've got impingement of the shoulder. The shoulder seems to be riding a little forward in the socket, and it's making it difficult for me to sleep at night. So we're going to try doing a little bit of a positional correction with the kinesio tape, as well as some patterns with the tape that will facilitate drainage of some of the swelling. So that's the other way that we can help control edema in patients as well. So we'll show you that technique, and that will sort of wrap up the swelling management part of this instruction. And then after that, we'll get more into some of the exercise techniques that are appropriate for the 1.5 to 2 week post-op stage that I'm in. All right, so we'll tune back in here in a few minutes.